Mr. Chair. Thanks for this hearing. I don't know if everyone in this room knows this, but today is Senator Markey's birthday, I believe. I could not miss this opportunity to embarrass you in front of the whole committee staff.
You've been very successful.
It's always dangerous to go against your committee, your subcommittee chair, your committee chair like this, but happy birthday, Ed.
Thank you.
I really appreciate all of you, and I appreciate very much this hearing. And I'm getting clearly this, the broad message of this hearing, which is that we need to take a comprehensive and holistic approach. We need to improve access to education about infection prevention measures like vaccines and hand washing. We need to make sure that we're using antimicrobials responsibly, whether it's in the hospital or in agriculture or in veterinary medicine. And we need to be investing in the development and manufacturing of new antibiotics in a market that isn't broken, in a market that is really fixed, that is working well. And so I want to dive into this from the perspective of shortages in antibiotics and what we've seen with this issue, and whether or not this question of supply chain is part of the broken part of the market. We saw shortages of antibiotics in this last year. We know that this is about, sometimes it is the antibiotic itself, or sometimes it's the component of the drug that we don't have. And it was with this in mind that caused me to team up with Senator Cassidy on our now law, the Onshoring Essential Antibiotics Act, which basically helps to expand, the concept is to expand domestic manufacturing capabilities by allowing HHS to award grants to antibiotics manufacturers to build or upgrade facilities here in the U.S. to basically onshore our supply chain. So let me start. Dr. Boucher, could you just talk a little bit about how you see this shortage affecting patients and your view of this?
Thank you, Senator Smith, for the question. We've seen antibiotic shortages for some years, and we see them almost routinely. Our hospital pharmacists send a thing out every week telling us about shortages, and we manage them often creatively, thinking about substitutions and ways to manage, but sometimes it's not easy, and sometimes it does affect patients. I'm in a very fortunate position to have expert pharmacists who work with me, and supply chain experts in rural hospitals, in critical access hospitals. It's not so easy, and the impact is greater. So addressing this is a huge need, and thank you for your attention. I will mention that especially injectable antibiotics require very special kinds of manufacturing often, which is difficult. And this is part of the reason we need a more robust pipeline, and we need to think about things like oral antibiotics. We haven't had a new oral antibiotic in over a decade.
Well, I think one of the things that we learned from the pandemic is the threats that we have when we do not have onshored manufacturing of so many things, including antibiotics. So maybe I'm wondering, Ms. Lawrence, if you'd like to comment from your own personal experience, whether you've seen issues with not being able to get access to an antibiotic that you really needed because it just wasn't available. Not about price, it's about availability.
Yes, thank you for the question, Senator Smith. I have been impacted by antibiotic shortages and other medical or medicinal shortages as well. And I am extremely fortunate to have an amazing care team at Boston Children's Hospital that knows how to work, pull, navigate. I also happen to have a best friend who's a pharmacy manager and can help with the pharmacy side. But I am very lucky to have that. And if I didn't have that, if I were elderly and didn't know how to navigate the system, or if I, didn't have the connections that I have, I would not know even where to begin to work around that shortage.
Yeah, thank you for that. I think that's really important. And you both are making the comment about how, antibiotic shortages affect different people differently based on who they are, where they live. I just have a few more minutes. Dr. Apley, I wanted to ask you about the concept of One Health and the idea that human health and animal health are inextricably linked, and that too often our federal agencies that oversee this sort of work in their silos rather than thinking about how we need to be thinking again holistically and comprehensively about bugs. And so I'm wondering if you could talk a bit about this concept, what you see around the One Health framework. Senator Young and I worked on this together, and we have been working hard with the Department of Agriculture in particular to get this One Health framework adopted. Could you just talk a bit about where you see this going?
And again, going back to experiences on packed carb, that was one of the fundamental underlying things is we are all into this together. If you look at the list of the American Veterinary Medical Association important resistant organisms in veterinary medicine, and you look at the CDC's list in human medicine, you'll see Pseudomonas, Staph aureus, non-typhoidal salmonella listed in both. So we share a lot of organisms that we have challenges with. And we also share a lot of the same needs for diagnostics, for helping get the best information to our practitioners, together understanding our human behavior and its interaction with how we dispense. And so many of the same messages, so much of the same information is vital to both physicians and veterinarians that it is absolutely wrapped up together.
Thank you. I know I'm out of time, Mr. Chair. I appreciate this hearing very much.